Life-saving home care. Why patients on a ventilator with tracheostomy need 24/7 CCRN support at home to leave the ICU. My name is Patrik Hutzel from intensivecareathome.com, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies, including home BiPAP, home CPAP, home tracheostomy care without ventilation, home TPN, home IV potassium, home IV magnesium, home IV antibiotic infusions, central line, PICC line, Hickman's line, as well as port management at home, nasogastric tube, PEG tube, nasotracheostomy, as well as PEG tube managements at home, also cough assist management at home, as well as palliative care and ventilation weaning at home. As the global healthcare landscape evolves, more and more patients in intensive care who require life-sustaining technology like mechanical ventilation and tracheostomies are making the transition from the often chaotic, very expensive environment of the intensive care unit or ICU to the comfort and familiarity of their own home. However, this transition is also not without its risks and complexities. Today, I want to talk about a healthcare consultation that I had this week with a gentleman who was inquiring to us here at intensivecareathome.com about home care for his wife, who's currently undergoing a challenging journey in ICU. And it highlights a critical, often overlooked necessity that 24/7 specialist nursing care at home with ICU nurses and CCRNs is a possibility, because our mission here at intensivecareathome.com is to provide this level of care. We specialize and have specialized now since 2012 in delivering intensive home care for the most vulnerable patients, adults and children, including those who are ventilator dependent, tracheostomy dependent, in line with established evidence-based guidelines and policies. Let's look at how to navigate complex care needs. ICU level expertise at home is non-negotiable for the right patients and families who want that. The health consultation that I had this week with Joseph, it painted a clear picture of his wife's deteriorating condition in ICU and the inadequate care she received outside of ICU as they were trying to send her to a hospital ward, and she was in uncontrolled pain and so much anxiety on the floor. And then she had a dangerous drop in oxygen levels, which necessitated a return to ICU. This scenario underscores a harsh reality. General ward care is simply not equipped to manage the volatility and complexities that critically ill ventilator and tracheostomy dependent patients are often going through. When Joseph inquired about home care with a ventilator and tracheostomy, he is in essence asking, how can I ensure my wife's safety and well-being at home after everything she's been through? But what he's also saying is also, how can I ensure my safety and well-being at home after everything I've been through with my wife in ICU? The answer lies in adhering to established safety protocols and evidence-based guidelines, which leads me to the gold standard. Why 24/7 critical care registered nurses at home? Well, the transition to home mechanical ventilation with intensive care at home is a life-altering decision for families and patients, offering a vastly improved quality of life compared to prolonged institutional ICU care. However, to guarantee patient safety and truly provide intensive care at home, 24/7 direct access to specialist nursing care is mandatory. Why? Number one, immediate crisis management. A patient on a ventilator with a tracheostomy, especially with underlying lung issues, is at constant risk of life-threatening emergencies such as respiratory distress, ventilator failure, or loss of airway patency. For example, a tracheostomy blockage might happen. Only a CCRN which is a critical care registered nurse, is trained and experienced to recognize the subtle early warning signs and execute life-saving interventions immediately. Number 2, ventilator and airway management. Ventilators require continuous monitoring and adjustments. According to the evidence-based mechanical home ventilation guidelines on our website at intensivecareathome.com, alterations to a ventilator or ventilator settings must occur exclusively upon doctor's orders and be carried out by critical care trained registered nurses. Furthermore, invasive mechanical ventilation requires a sophisticated secretion management program, humidification, nebulizers, and meticulous tracheostomy care, all complex tasks that fall squarely within the CCRN's scope of practice. Number 3, holistic critical care. Joseph's case shows that his wife had other issues as well, including pain and anxiety, which complicated her recovery. CCRNs are adept at managing complex medication regimes, including pain and sedation, and addressing the psychological needs of critically ill patients, ensuring a stable, therapeutic, holistic, and most importantly, patient and family-friendly environment. And again, evidence-based mechanical home ventilation guidelines demand specialist nursing care at home for home mechanical ventilation and tracheostomy. The evidence is crystal clear. Safety and outcomes are directly linked to the level of expertise present in the home. The evidence-based mechanical home ventilation guidelines on our website at intensivecareathome.com again explicitly state that for patients requiring mechanical ventilation and or tracheostomy, a second ventilator need to be there. A backup power supply is required. Backup tracheostomies are required. Even more important, the core of the guideline demands that care be delivered by nurses with specific critical care competencies 24/7. I also mentioned to Joseph that we need to look at his wife's medical records as well to determine the feasibility and safety of home care, of course. And we also need to speak to the intensive care team. And this is, absolutely the right first step. It's only after a thorough review of a patient's stability, ventilator settings, ventilator requirements, tracheostomy requirements, overall clinical status that a safe transition plan can be formulated. Is the patient ventilator dependent 24/7 or only partially during the day? And only then can a transition at home be commenced. The conclusion is that prioritizing safety and quality of life is critical. The journey from ICU to home is a testament to resilience and also hope. However, it must be paved with safety and high-quality nursing care. Joseph's commitment to finding a better alternative than the ICU, or long-term ICU, I should say, is commendable. For patients like Joseph's wife, intensive care at home provides the solution, but also for ICUs that are in need of ICU beds, intensive care at home is also a solution, a bridge between hospitals and a safe quality field life at home, ensured by the unwavering presence of 24/7 critical care registered nurses. Now, with intensive care at home, we are currently sending our ICU and critical care nurses into the home 24 hours a day. We are providing the following: home care services for ventilated adults and children with tracheostomies with critical care nurses 24 hours a day. A genuine alternative to a long-term stay in intensive care or long-term acute care, tracheostomy care for clients without ventilation, home care services for patients on non-invasive ventilation such as home BiPAP, home CPAP, home TPN, which is also known as IV nutrition, home IV potassium and home IV magnesium infusions, IV fluids, and IV antibiotics. We are providing central line management, peak line management, Hickman's line management, as well as port management at home. We're providing nasogastric tube and PEG tube management at home, the use of cough assist machines for our clients for airway clearance at home, palliative care services at home, as well as ventilator weaning at home. We're also sending our critical care nurses into the home for emergency department bypass services. We have done so successfully as part of the Western Sydney Local Area Health District, their In Touch program, saving approximately $2,000 per patient that we keep at home instead of them going to an emergency department. That also means we're in a position to cut the cost of an intensive care bed by around 50%. An intensive care bed costs between $5,000 to $6,000 per bed day. Our service costs between $2,500 to $3,000 per bed day, and we're freeing up the most sought after bed in the hospital, which is the ICU bed. Most importantly, we're improving the quality of life for patients and their families, which is a win-win situation for all stakeholders. Of course, quality of life is much improved surrounded by families and by a team of dedicated intensive care nurses in the home care setting instead of in an intensive care unit. With intensive care at home, we are currently operating all around Australia in all major capital cities as well as in all regional and rural areas. We work with NDIS clients all around Australia, TAC and WorkSafe in Victoria, Department of Veteran Affairs all around Australia. Our clients and we as a service provider have also received funding through public hospitals, private health funds, as well as departments of health. We are having policies and procedures for intensive care at home nursing, and we've built all the intellectual property for intensive care at home since 2012. No other provider in Australia has created more intellectual property when it comes to intensive care at home nursing than we have. This puts us in a position to employ hundreds of years of critical care nursing experience combined in the community. No other service provider in 2025 employs a higher skill level in the community than we do, which enables us to look after the highest acuity adults and children in the community in Australia safely. So if you're at home already, and if you're watching this, or you're stuck in an ICU long-term, or if you're going to hospital and ED all the time, and you realize that you don't have the right level of support at home, or if you are stuck in an ICU, I'll give you a real-world example today how we can help you. One of our first clients when we first got started in 2012 was a client who was at home initially on a ventilator with a tracheostomy with a support worker model 24/7. Of course, support workers are not equipped to look after a client at home on a ventilator with a tracheostomy. That is dangerous and it's simply negligent. Having support workers looking after a client at home on a ventilator with a tracheostomy is like flying the airplane with the cabin crew instead of the pilot, because anyone on a ventilator with a tracheostomy is at very high risk of medical emergencies 24/7, or even at high risk of dying if they don't have a team of dedicated critical care nurses looking after them 24/7 at home. This is actually evidence-based and is documented in our mechanical home ventilation guidelines that you can find on our website at intensivecarehome.com. Think about it. In an intensive care unit in a hospital, you wouldn't have support workers looking after your critically ill loved one or after any critically ill patient on a ventilator with a tracheostomy. So why would anyone in their right mind do that in a home care environment in the community? So this client at the time found out about us eventually, and the ICU that he was basically living in also knew about us and eventually reached out to us. And we were proving our concept with this client very fast. When we worked with this particular client, we sent him critical care nurses 24 hours a day, and he never ever went back into ICU ever again, as long as we were working with this client. We can do the same for you if you're not safe at home and help you with keeping you at home predictably. Otherwise, we would not be in business. Again, the same is applicable for those stuck in an ICU, similar to this case study that I've just given you. Or if you're going back to ED all the time, please reach out to us. We can help you with taking you through the right steps, including how to get funding with different funding bodies. This is also why we are providing NDIS support coordination. We have a team of NDIS support coordinators, and they have a wealth of knowledge. I've done an interview with Amanda Richards, one of our NDIS support coordinators, and I'll put a link to an interview with Amanda in the written version of this blog. We're also providing TAC case management and WorkSafe case management in Victoria with Lucy McCodder. If you're an NDIS support coordinator or a case manager from another organization watching this and you're looking for nursing care for your participants, please reach out to us as well. If you need more evidence for nursing care, we are also writing NDIS nursing assessments with legal nurse, critical care consulting nurses. If you are a critical care nurse and you're looking for a career change and you want to join a very progressive, dynamic, and high-performing team of critical care nurses in the community, we're employing hundreds of years of critical care nursing experience combined. You can join this high-performing team if you are a critical care nurse. If you are looking for a career change as a critical care nurse, we're currently hiring for jobs for critical care nurses in Melbourne, Sydney, Brisbane, in Albury, Wodonga, in Bendigo, in Geelong, in Warragul, in Victoria. If you have worked in critical care nursing for a minimum of 2 years, pediatric ICU, ED, and you have already completed a postgraduate critical care nursing qualification, we will be delighted hearing from you. I do have a disclaimer though, because we are offering a tailor-made solution for our clients, which includes regular staff. Our clients also do want the same staff coming over and over again because they are so vulnerable and so special. That's why we need regular staff. So if you're looking for agency work where you can come and go, this will not be the right fit for you. We are looking for consistency and our clients are looking for consistency. So please only apply with us if you can give us regular and consistent availabilities for shifts and you're really keen on building solid relationships with us and with our clients. If you're an intensive care specialist or an ED specialist, we also want to hear from you. We're currently expanding our medical team as well. We can also help you eliminate your bed blocks in your ICU and in your ED for your long-term patients or for your regularly readmitting patients with our critical care nursing team at home. We're here to help you take the pressure off your ICU and ED beds, and in most cases, you won't even pay for it. Even if you do pay for it, it is so much more cost-effective than what you're paying for in ICU and ED, and you get the same level of care. And if you're a hospital executive watching this and you have bed blocks in your ICU, ED, and respiratory wards, or for home TPN, please reach out to us as well. We can help you eliminate your bed blocks very fast. If you're in the US and in the UK, and you're watching this and you need help, we want to hear from you as well. We can help you there privately with one-on-one consulting and with hiring nurses privately. Once again, our website is intensivecareathome.com. Call us on one of the numbers on the top of our website or simply send us an email to info@intensivecareathome.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and intensive care. Click the like button, click the notification bell, share this video with your friends and families, and comment below what you want to see next or what questions and insights you have from this video. Thank you so much for watching. This is Patrik Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.